Well, hello, hello. It is Sarah Jane from Animal Wellness and Vital Animal Health. And I want to speak to this distressing increase that I'm seeing in kidney failure, renal failure in specifically in cats, and how you can support your animals. First off, what it is and how you can support your cat in keeping them comfortable if they are in renal failure. So if you have a cat that's been losing weight, or it's drinking excessively and urinating all the time, and perhaps urinating in outside of the litter box, these can all be red flags that your cat is experiencing some kind of urinary issue, whether that's an infection or something more sinister like renal failure. So remember, my resources, my ability to show up here as an alternative healer. I'm not a veterinarian. I am an energy worker. I work with epigenetics, and I work through various holistic integrative approaches to be supportive of keeping your animals happy and healthy. So this is not a replacement for veterinary care. And of course, if your animal is not looking well, please don't hesitate, especially with your cats. If they've stopped eating or drinking, this can be a sign that something is very, very wrong. And if you suspect that your cat is suffering from kidney failure, or your cat's already been diagnosed, just know that there is hope. There are alternative methods that you can use to give your cat the best quality of life that they can, especially at the end of their lives, because kidney failure is probably one of the most common causes of feline death around the world. And I know I speak about this all the time, the dangers of feeding your cats, which need to have a very high protein diet. And if they were out in the wild, would be eating live, fresh prey, that this pretend food, this kibble that is mostly made of, and those are my dogs, this is real life, sorry, it's not food, and it's probably one of the biggest culprits, if not the main one, that is contributing to this rise in renal failure in cats. And it's a big business for big pharmaceutical companies. So, we're looking at, I always prefer to look at prevention is much better than cure. So getting your cats especially, onto a live prey protein, high protein based diet is the biggest gift that you can give to your animals to prevent this later on down the line. And I often hear that people say, yes, but it's too expensive to feed your animals raw and live or fresh meat proteins. And my question to you is to just rethink that even though it might be saving you money in the short term, it's going to cost you in veterinary bills, in emotional distress, and a lot of concern later on in the line if you're not feeding your animals raw or whole food, species appropriate diet. So if you are considering or are in the process of weaning your cat off dry food and onto a live prey diet, I know it's a very slow process. It takes a lot of patience and persistence, because cats tend to be very picky eaters. So be patient with yourself, be kind to yourself, and above all, don't give up, because they will not starve themselves to death. And eventually, through animal communications as well, your animals are really going to get that you have their best interests at heart. And I cover this in depth on how to make that transition, recipes, quantities, portion sizes, and everything that you need to know in a fully comprehensive little book called Pause for All: Whole Food for Happy, Healthy Pets. And it also includes a huge, concise index of symptom specifics to Bach remedies, flower essences for any kind of symptom that your animal might be expressing, so that you can really have the confidence and trust that you are enough, that you're educating yourself, and you have your animals best at top of mind all the time. So take a look at that. All the proceeds do go to Claw, which are one of my cat and dog charities here in Johannesburg. They do amazing work on the ground, and also feeding the furballs in Durban, which are an incredible organization that feed a lot of feral cat colonies. So back to what the sort of stages and classifications of renal failure in cats can look like are chronic renal failure and acute renal failure. So just know the difference between that is chronic renal failure is not reversible, right? But it is manageable. Chronic renal failure is a progressive destruction of your cat's kidneys, and mostly a disease of older cats, you know, where it progresses very slowly, but it ultimately is terminal. And increased blood pressure due to hyperthyroidism is also a very common culprit in the development of chronic renal failure in geriatric cats. And that was certainly the case with Winston, my old guy, that finally needed some assistance in the transitional process, because he just had enough. His body was shutting down, his kidneys were shutting down, and he lived a really, really great life. So sometimes our animals do need our help in the dying process as well. And I don't even like to call it the dying process, because animals have taught me that there is no death. There is only rebirth and regeneration, and they do come back, especially if they haven't completed their soul contracts with us. But that is another session for another day. So just know, when we're looking at acute renal failure, it tends to be much more aggressive and present symptoms within a few hours or days after that sort of initial insult. And it can be reversed. So have faith. Trust that with aggressive treatment, it can be reversed. So eating toxins like lilies or raisins or grapes or radiator fluid, certain kind of pain pills that have ibuprofen in it, and extreme dehydration. I've had cats that have been sort of locked in garages for 2 or 3 days, and being brought literally back from the dead through a very aggressive holistic treatment. But treat it as an emergency, you know, get them straight to the vet, get them rehydrated. And if you do suspect that your cat has been exposed to any of those those substances and appears to be sick or lethargic, contact your vet immediately. If you haven't seen the other video that I did on how the 9 sort of signs that you need to pay attention to in when you're looking at your cat as being anxious or stressed, take a look at that. I will post a link below. So know that in when we're looking at the stages of renal failure, there are really 4 main stages, and treatment's always going to vary with each stage. But the stage of renal failure is independent of the classification of acute or chronic renal failure. And some experts divide 5 stages of renal failure according to the bile and the creatine levels in the blood. So just for today, I don't want to bombard you with too much information, and I'll probably break this down over the next couple of days into bite-sized chunks so that you can really digest this and then assess and come back and ask me questions. But let's take a look at these 4 stages. So the first stage is where your cat's kidney function is between 33 and 99%. And just note that the body only requires 25% of kidney function to be able to filter out toxins and do the job in keeping this essential life force energy strong. And because of that, kidney failure is most often detected much later on. The treatment for early kidney insufficiencies is always about increasing water intake and supplementing with electrolytes. And there's a lot of YouTube videos. I think I have one where I show you how to deliver sub-Q fluids just under the skin, and how to do that so that you can do this from home without having to take your animal into the vet and increase their level of anxiety and stress. So stage 2 is that sort of late stage kidney insufficiency where most of us really recognize it. Then you're looking at the function of the kidneys being around 25 to 33%. And you can see that the kidneys are really beginning to struggle. They're not able to filter. You probably start to see that your animal has less energy, that they're slowing down. They may be sleeping more. They may be urinating less. And again, this can be treated through diet modification and anti-nausea medication, which can be simple as giving them like Tums or a Pepsid AC. So if you're in doubt, check in with your vet, and also look online, look at the resources, because I have many that you can really start to feel that you have the confidence to help your animal. Stage 3 in early sort of kidney failure, your cat's kidney function, as I said, ranges between 15 and 25%. So your vet will want to start an aggressive treatment that might and probably will include medication, because the prognosis for renal failure in stage 3 can be anything from several months to 4 years. And treatments, as I said, for early renal failure always include those sort of sub-Q fluids and something like an anabolic steroid like stanza solo. And there are generics of that too. So be willing to ask your vet questions, and don't, trust what your gut says, because if you're working with a homeopathic or a holistic vet or an integrative health practitioner like me, a lot of the times I suggest things like CBD oil or herbs and essential oils, or Bach remedies that are going to stimulate the appetite and bind protein in the intestine in order to reduce the stress on the cat's kidneys and increase the red blood cells, because that's really what we want. And acupressure is part of my treatment program, again, to decrease nausea and just stimulate red blood cell growth. And if you work with me, you're going to know how to agitate those acupressure points without having to go to an acupuncture for needling, which of course is the next stage that is available to you. Or you can use the photonic red light therapy on those acupressure points and get great results. So stage 4 of it is really that end stage of kidney failure, and your cat's kidneys now are probably less than 15% functioning. And you might have been on this path of aggressive treatments for a couple of months and keeping your cat as comfortable as possible. So end-stage renal failure treatments often include IV fluids, those sub-Q fluids we're talking about, any kind of phosphorus binders to decrease phosphorus levels, and a very precise dosha type specialty diet to really aid the kidneys. And if you're really, really lucky and you live in a part of the world where your vet offers kidney transplants, that is always an option. But a lot of the time when we do animal communications with these animals that are nearing the end of their days, they're normally very content to pass. And I always ask them, do you know that you can you've been an amazing companion, and you can go and get yourself a good, healthy new body. There's some kittens being born down the street. Why don't you go there? And I also do offer in my Being Human Through Animal Communications and Body Processes various techniques and hands-on or off-body processes that can, again, also help optimizing urinogenital function, optimizing kidney function, optimizing the organs, endocrines, and body parts. And also ways that you can prepare and support your animal in dying quietly, transitioning quietly in their sleep. So if that interests you, there's a whole section on that in the Being Human Through Animal Communication class. But one thing, just going back to organ transplants like kidney transplants in cats, if the animal isn't on board, and this is where animal communication can be such a beautiful contribution to your animals, to really honor the choices that they want and get out of the projections and expectations and rejections or separations of you not being ready to let your animal pass, is that the success rate for transplants, just like in people, is okay, but 25% of cats do die from those kidney transplant rejections. So specialty diets can play a very major role, as well as the addition of things like CBD oil and amino acids and a very specific prescription-based protocol that is appropriate and aligned with what your cat's needs and wishes are. And through just diet alone, as I was saying, if you just change your animals onto a raw diet now, while they're healthy, you're going to reduce incidences of acute crises like renal failure later on. And a diet appropriate for renal failure is more than just a low protein diet. So just remember that. It's not a matter of just putting them on high protein. It has to be done in a way that's really aligned and a priority for your cat. And because cats or kidney failure is so prevalent in the death of most domesticated cats, being familiar with the symptoms is a very important part of keeping your animals well, so that you can detect it early and get onto a treatment plan designed to really extend the length and improve the quality of your cat's life. With acute kidney failure, knowing the symptoms can be a matter of life or death in as little as 48 to 72 hours. So let's address the difference between chronic and acute renal failure, because the symptoms related to both and the symptoms that you can expect as a cat that is in kidney failure progresses towards those end stages. So just remember, chronic kidney disease in animals, it is the progressive deterioration of the kidneys. And as the function decreases over time, your cat's going to really struggle, your dog, to excrete waste products, right? Cellular debris and any kind of waste or toxins through the urine. So there's going to be a backlog or an accumulation of toxic waste in the blood. So working with a lot of Chinese herbs can be a great way to start to optimize that elimination process and clean the blood. And with treatment, even though it's never going to cure chronic renal failure, it can and does slow down the progression of the disease and make the symptoms a lot more manageable and your cat a lot more comfortable. And because, as I said earlier, your cat's body only needs 25% of their kidney function in order to filter toxins. And once your cat begins to show symptoms of the disease, he may already be in stage 2 or 3 of renal failure. So the symptoms, as I said earlier, to look out for are things like increased thirst due to frequent urination. That's the most common sort of red flag that people are alerted to first. Other things can look like anemia, a lack of appetite. There's an apathy and a sluggishness to them. So maybe they're really sleeping, or it's hard to rouse them. And I know it can be very distressing, but seeing blood or cloudy urine, changes in their water uptake, dehydration, when you pull their skin and it doesn't go back, discoloration, which kind of goes into the anemia part of, check your cat's gums. Are they discolored? Are they pale? How does their tongue look? Is their coat very dry? Do they have flaky skin? Do they have bad breath with a very sort of ammonia-like smell to it, a very bitter smell to it? Are they losing weight because they're not eating? And when we're disorientated because we have kidney infections, you might have felt yourself go into that sort of very hot, too much heat in the body. So there's a very cold sweat and lucidity goes. So we and our cats and dogs show this as well. It's like they're discombobulated, they're stumbling around, they look like they're drunk. Vomiting is another one, and as I said before, just general weakness. They're just not as vital as they used to be. And I think the most important thing, as I keep saying, is to know acute renal failure is a life-threatening emergency. So you want to get your animal to the vet at the first sign that something is wrong and that your animal could be in renal failure. Remember, acute kidney failure in cats is not progressive. So instead, it sort of refers to the sudden failure of the kidneys to form their function of filtration and allowing the toxins to flow through the body. And acute renal failure is caused by a very specific event, such as I said before, eating toxins, dehydration, insect or snake venom bites, sometimes even being stung by bees multiple times can bring that on. So it's any kind of trauma to the body, but it can also be an accumulation of unresolved toxic trauma or stress that is being held in the body from a previous event or lifetime. Heat stroke, any kind of infection, some medications, systemic shock, all of that can cause things that contribute to renal failure. So if you think your cat has been exposed to any of these toxins or poisons, go to your vet immediately. Do not wait, because as I said, and I'll say it again, acute kidney failure can be reversed. But the success relies heavily on how quickly you can get your cat into treatment and onto a treatment plan. And then I suppose in closing, I just sort of want to recap on acute renal failure. Those symptoms are pretty much the same symptoms that I've just mentioned for chronic renal failure. The difference is the symptoms are very sudden. They kind of come out of nowhere, and there's a severity to it. So you might have had a cat with chronic renal failure that starts vomiting on a more regular basis. They can't keep food down. And a cat with acute renal failure will vomit several times within an hour. So, that is a hugely distressing symptom, and one that needs your immediate attention. So let's talk a little bit about what end-stage renal failure, which is any cat lover's worst nightmare. But when you're at that stage, it really is time to decide when and if you plan to assist your cat in the transitional process, and a really good time to book an animal communication session and ask your animal what they want and if they need assistance in death. Because if you do have the resources available, end stage of kidney disease, it is worthwhile to aggressively, treat your cat with sub-Q fluids, IV fluids, herbal supplements, appetite stimulants, as I mentioned. But some cats maybe don't want that kind of invasive treatment. Maybe they're just done. They're so tired, and they've had a good life, and they don't want you to interfere in that. So being able to have an animal communication session with your animal, or learn how to do that, to have those deep conversations with your animal, can really save a lot of heartache and prolonging any kind of suffering. When you sort of see them wasting away and their coats are dull, and you can just see that they're nausea. Maybe if you're very kinesthetic, you feel nausea when you kind of connect heart to heart with your animal, and you're concerned because they're not eating. They're getting constant infections due to a compromised immune system, and it doesn't matter what you do, there's just this extreme dehydration and incontinence that keeps showing up. So even something as simple as I said, that specialty diet can help your cat live a better quality of life. But if you start noticing strange behavior in your cat matching any of the symptoms that I've spoken about above, please just go and put yourself at ease and know what you're dealing with by taking your cat to the vet to have them checked out. Because as I said, a lot of time is of the essence. And if you know what's going on, then you can take aligned actions that are in honoring of your animal's choices on what treatment plan you're going to follow, and look at your budget and what you want to do in increasing that quality and the length of your cat's life. So many cats they do suffer from end-stage renal disease, and it's heartbreaking to see any of the animals that we love or people suffering like that, because we know that death is coming. And again, as I said, animals don't like to talk about death because they don't see it as an end. They just see it as a transition into another energy state or vibration where, if they're choosing, they will incarnate. So a lot of times the subcutaneous fluids can be really helpful in keeping the fluids in place. So a lot of times I sort of suggest starting 100 and 150 cc's of balanced electrolyte solution that you can get from most of your vets, with a drip and a tap that you can turn it on or off. And you're going to know how often your animal's going to need that. Sometimes 200 cc's every other day is more manageable. That's certainly what my Winston wanted at the end of his life. But most dedicated cat guardians can easily administer sub-Q fluids with a drip setting in a fluid bag with an 80 or a 20 gauge needle, with very few problems or complications. If we're looking at how to control this excessive nausea and vomiting, there's a lot of ways that you can do that too, because we need to start looking at the buildup of acid, right, which creates the kidney stones and ulceration and a lot of gastric irritation. So H2 receptor blockers, and your vet will know what they're doing, such as ranitidine, cimetidine or famotidine. These are sort of pepsids or Tums, will reduce those sort of gastric acid secretions, and they can really help improve appetite and food intake. There's something called sucralfate, or carafate, depending on where you live, which is often given to patients that have significant evidence of gastric ulceration. And then there's something called metoclopramide, or Reglan, which is the registered name, depending again on where you live. There are generics available too, which can also help with the nausea and the vomiting and the lip smacking or whatever's going on. And always, a lot of times these drugs should be taken at least 60 minutes before you offer them any food for best results. You also want to look at controlling elevated phosphorus, because renal function will fail to the point in which those serum phosphorus levels can't be managed with dietary restrictions alone. So it's taking something, like 30 to 90 milligrams per kg per day of aluminium hydroxide, which is a form of phosphate binders, will help control those elevated levels of phosphorus. And again, these need to be given prior to a meal for maximum effects. When we start looking at anemia, which develops in later stages of the failing kidneys, human recombinant erythropoietin, EPO, increases red cell mass in cats. But most cats will develop antibodies against it at some point. And then these treatments would have to be discontinued, and your vet will let you know when that would be. So always wait until as late in the course of the disease as possible before using EPOs. And also, be reassessing all the time, because you need to see how your cat is doing on whatever prescription it's on. And you're wanting to be looking at things like paying close attention to their body weight, because subtle weight loss can indicate not only continuing deterioration from the renal function or the presence of a new concurrent problem in older cats, such as the hypothyroidism that my Winston had, or things like IBD. And oral health is very important as well here. And dental prophylaxis should be performed as needed, but you want to be doing these things while your animal is healthy, not when they're already having a very poor immune response or a very low vital life force energy, because then there's always the concern of anesthetic adding to that toxic burden that the kidneys and the liver then have to flush out of the body. So, blood pressure should be reassessed. And there's lots of ways, that you can actually stimulate kidney points on the cat's ears along the spine. And I go into that in depth in the Animal Communication Body Process online learning program. So just know, I know how difficult it can be to see your animals suffer, especially when everyone has a different opinion on what to do. So I always say, trust yourself, trust that your animal knows and will tell you. And make informed choices. Excuse me. I'm choking on my own spit. So, yes, the diet that you choose, it must be something your cat will eat. Unfortunately, many cases of death from kidney disease are due to starvation. So if you feed the best kidney diet in the world, but your cat won't eat the food or eat enough of the food, it's not going to work. So cats with renal failure, they have to eat food. As I said, you get to 2 days of your cat not eating, they're going to develop fatty liver. It's a death sentence for your cat. Your cat has to eat enough food and of the right food to maintain adequate body mass, and have the protein builders to do as much as they can to heal and raise their immunity, or they're going to starve to death. So it's very important that your cat is eating. And muscle wasting from a lack of food can also have a lot more serious adverse effects on your cat's quality of life than almost any diet. So a lot of experts agree, that I've interviewed over the years, that diet has a major effect on kidney problems in cats. We know that without a doubt. Kibble is not food, because there's no water value. It's not very palatable, and it carries a lot of carbohydrates through fats. And we need protein. We need to give our cats protein, because they need protein. They are born hunters. And if you're struggling to improve your cats in transitioning in their diet, then you really need to look at feeding your cats a prescription of low protein diet before the development of any kind of renal disease can cause any kind of detriment to their health. So starting dietary management with bun and creatine are elevated in presence of dilute urine and or when phosphorus is elevated. So you want to, again, you're going to need your vet to do some tests to see where your animal is, because bun and creatine are two substances that are found in the blood that are indicators that the kidneys are struggling to filter nitrogen waste products. And if they are present, this is where we get urinary blockages and kidney stones and dehydration and ultimately renal failure. And we really want to really look at how we can help this during the early stages of renal disease to lower phosphates, so that we're not bringing in additional stresses on the kidneys. And low protein diets in that treatment, it's debatable, but most veterinarians still recommend low protein diets in cats with renal diseases, and studies exist supporting the use of low protein diets in cats that have damaged kidneys. So the protein should ideally be meat-based, not plant-based, and also included extra potassium, low sodium, high levels of vitamin, all the B vitamins, increased fatty acids, and additional fiber. Because the less protein in the diet, the less nitrogen waste that you're going to have in the blood. And the less nitrogen waste there is, the better your cat's going to feel. And it is really that simple. So, you know, if it's not simple for me, it's not the trust protein. So just you know, take this all in. I know it's a lot of information, and there's a lot of great support out there, but you want to look at all of this, including how to manage acidosis in the body, which is also another complication of renal failure that contributes to the nausea and the vomiting and the lethargy and the muscle wasting and the weight loss and everything else. And again, commercial diets are designed to be alkalizing. I don't like commercial diets. I prefer to create live, healthy options for your cats instead. But you really don't want to be feeding any sort of acid, high acid, so very rejasic diets that are that can be detrimental in that sort of stage 3 or 4 of renal failure. And then, you know, when we're looking at fatty acid supplementation, we want increased polyunsaturated fats because they can lower those elevated cholesterol levels that we see in cats with chronic renal fatigue. So reduced cholesterol levels have also been associated with the preservation of the same in dogs, right, when they did this sort of experimental study. So you want to be giving your animals a really good quality omega-3. I love any kind of medium chain fatty acids like coconut oil and all of those that are really good and can add taste into stimulating the appetite again, because fat is good. So any sort of dietary protein restrictions limit those uses of proteins as an energy source. So when we're doing that, as I said, we're doing that to reduce the nitrogenous waste in the blood. But cats still need a lot of energy in their diet to function normally. So fats are the best way to give that to them. My cats love avocados. They love coconut oil. And, you know, it's just like sometimes you might want to increase carbs for energy in the diet. But they will induce diarrhea in an already dehydrated cat. So I always say stay away from it. because a lot of cats with renal disease, they also often lose potassium in the urine in order to conserve the sodium, and the low potassium is what leads to that poor hair quality and that sort of stiffness that you see in their gait, or that muscle weakness. And unfortunately, a lot of cats do reject potassium-rich foods such as bananas and tomatoes. So potassium gluconate is probably one of the best things that your cat will accept when you just sort of mix it in with their food. So try that. As far as low calcium goes, we want to really treat that lower calcium by increased phosphorus, which we know is common in renal failure, is usually associated with low calcium. So when phosphorus decreases, calcium will self-correct. The body is a self-correcting mechanism. But if correction doesn't accompany reduced phosphorus, then you need to start looking at considering vitamin D3 drops. Low salty diets with those sort of enhanced omega-3s and omega-6 fatty acid ratio may help reducing hypertension. But they haven't really been evaluated that well in cats that have renal kidney problems. And there is this potential for promoting sort of pre-renal azotemia, which reduces palatability and promoting excessive renal potassium wasting. So I do know that in certain experimental models, feeding high salt, so like 2 grams per 1,000 kilocalories, didn't show a lot of adverse effect, but feeding low salt, so like 0.5 of a gram per 1,000 kilocalories, that did activate neurohormonal mechanisms. So just look at vitamin supplementation and consult, ask your vet what your cat needs. Ask your cat what it needs. A lot of times when you're giving your cat a lot, or your animal a lot of things, isn't it the most beautiful thing to be able to muscle test, to be able to have a communication session with your animal, to ask what's working for it and what isn't, and in the long run eliminate the trauma of giving your cat too many things to digest or ingest, and also saving on unnecessary supplements that your cat's body actually doesn't need. So you want to be looking at, especially with renal disease, that those cats require much more water-soluble vitamin B and C, and they're often a lot higher in commercial diets designed for cats with this. But if those diets aren't used, use oral supplementation or mix it in with the food that you're preparing. But be careful using vitamins and mineral preparations, because a lot of them contain significant levels of calcium and phosphorus, which is not what your animal needs. So I'm going to leave it there because I know I've gone really, really long. I'll probably do another one of these and look at some of the medical treatments and case studies that I know have worked as far as dietary supplements and ACE inhibitors for protein losses, and sort of some kind of treatments that are available, so that you can explore all your options with your vet and really give your cat a good chance at either healing from early stage renal failure and how to just support good quality of life at that sort of end of time. So I hope you found this helpful and valuable. I'd love to know in the comments below if you find that was a long length of information and you prefer shorter chunks to be delivered, and sort of bite-sized chunks of daily body-mind vitamins, so to speak. Let me know, because I really want you to make informed choices and trust that you are enough, that you are capable, that you're willing to do whatever it takes in the best interest of your animal companion. And I'd love to help you with that, because I know that the best medicine is to be your own medicine. All right, so that's it for part 1 of this special series on renal failure in cats. And I look forward to hearing what you know and what's worked for you in creating better quality of life and healing in cats with kidney and urinary issues. All right, take care. Bye.